Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Triamcinolone. A brand name for this medication would be Kenalog. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Triamcinolone is a synthetic corticosteroid that has anti-inflammatory, antipyretic, and anti-allergy effects. It also exerts profound and varied metabolic effects and changes the body's immune response to different stimuli. The exact mechanism of action for anti-allergic activity is still presently unknown. In terms of indications for use, this medication can be used for acquired hemolytic anemia. It can be used for asthma as well as disorders of the eye. Inflammatory disorders of the mucoskeletal system can be treated with Triamcinolone. It can be used in perennial as well as seasonal allergic rhinitis. It can be used for some collagen diseases as well as gastrointestinal diseases. It can also be used to treat pain associated with osteoarthritis of the knee. And finally, it does have a place in therapy when treating leukemia. Now, before somebody was to use Triamcinolone, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be administered with a live vaccine. If a patient had a hypersensitivity to Triamcinolone or any other component of the product, they would not be able to use this medication. Another contraindication would be that it cannot be given intramuscularly to treat idiopathic thrombocytopenic purpura. And finally, it cannot be given as the primary treatment for status asthmaticus or acute asthma. Now, in terms of precautions, this medication has to be used cautiously in patients who are recovering from a myocardial infarction. It should be noted that blood pressure elevations may occur with intermediate or high doses of corticosteroids, so monitoring would be recommended in certain patients. Fluid retention or edema can also happen with average or large doses of corticosteroids. So we would want to use this medication cautiously in patients who have heart failure, hypertension, or renal insufficiency. Injection site atrophy may occur. It's also noted that it should not be given in the deltoid muscle. Hyperthyroidism or hypothyroidism may increase or decrease metabolic clearance of corticosteroids. A dose adjustment may be required in hyper or hypothyroidism. Anaphylactoid reactions, including fatalities, have been rarely reported with the use of corticosteroid therapy. We would want to avoid as best we can giving this medication to patients who have systemic fungal infections. We would want to avoid giving the injection in an infected site, a previously infected joint, or an unstable joint. Osteoporosis may occur in patients using this medication, especially in postmenopausal women. We would want to try to avoid this medication, or at least avoid high doses, in patients who have had a traumatic brain injury. There may be new onset or worsening of pre-existing emotional instability, as well as potentially psychotic tendencies, so monitoring will be recommended. Pediatric patients would have an increased risk of systemic toxicity when given the topical formulation. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Triamcinolone, there's many different ways they can receive their dose, but today we're just going to talk about the dosing for the intramuscular injection. If somebody is using this medication to treat seasonal or perennial allergic rhinitis, and they're using the intramuscular injection, they would typically use 40 or 100 milligrams injected into gluteal muscle. If somebody is treating asthma, collagen disorder, or a disorder of the eye, they would use initially a dose of 60 milligrams injected intramuscularly into gluteal muscle as well. Additional doses can be adjusted anywhere from 2.5 to 100 milligrams if the patient does require multiple injections. The number of injections required would depend on the patient's response as well as the duration of relief. For multiple sclerosis, 160 milligrams can be injected intramuscularly into gluteal muscle once daily for 7 days. Then 64 milligrams would be injected every other day for 1 month. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Triamcinolone, so I'll go over some of those here now. Some patients may experience Cushing's syndrome. 5 to 21% of patients may experience a headache. 5 to 25% may experience pharyngitis. And influenza-like symptoms seem to happen between 2 and 8% of the time. Now, some more serious side effects would be electrolyte abnormalities, gastrointestinal perforation, anaphylaxis, which is rare for this medication, cataract or glaucoma, which both are also rare, a disturbance in mood or unusual change in behavior, and finally, osteoporosis. That's all we're going to talk about today with Triamcinolone or Kenalog. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.